everybody. Welcome back to my virtual office with Dr. Kish. That's me. And I'm also a minister. So we're going to just, today we're going to go over poor blood circulation and some signs and symptoms that come along with it. And also some tests that we can have some tests performed, like a Doppler test, blood pressure, to monitor these situations. So you can go to your primary care physician if it's not me. I'm in California. I do Zoom patient visits and blood work. But like I said, it's just information to help you. So get your pen and paper out, and I want you to take some notes. And I'm going to read to you my notes today that I have for blood circulation. So we want to look at some signs and symptoms of what could be telling us we have some issues with our blood. And I'm going to provide some remedies for it. But once again, remember, this is information, and you are to work with your primary care physician, whether it be me or whoever your primary care physician is, so they can guide you. But I think it's important for patients to have information about what these things mean, because there's so much information on the websites these days. It can get confusing. So the number one first sign we're going to go over is that for poor blood circulation, you may have some tingling and numbness signals that go on in your fingertips and your feet. And you can have this due to lack of exercise, or you may recently increased your sugar intake. Okay, and the number two sign is swollen feet or legs. This is what we call peripheral edema. And there's a little test you can do. You can just push into your foot and see if it bounces back or it doesn't bounce back and it has an indent. So that's just telling us that the blood has become a little sticky, and we can have swollenness and fluid in our feet and in our hands, and making the pain and you just a typical being swollen. But the veins will get kind of stagnated with the blood that's not able to flow through. And then the other sign I think is very interesting is on your fingernails. If you look on your fingernails, you can see vertical lines. And if they are deeper, that just means that the blood flow going to the matrix of the nail matrix has been compromised, and we're not getting enough blood flow there. But this is just also another sign. So a few remedies for that is you can look into red vein leaf extract. And this other one is called serapeptase. And it's actually I believe it's from pomegranate. And it actually will help the red blood cells. And also, this can be a sign that you're deficient in B vitamin 12 and iron deficiency, or have an issue going on with the thyroid. But the nails also can give you a sign of red, white, and blue. It's called Raynaud's syndrome, Raynauds. And this is called the benfotiamine supplement. And I think that is the pomegranate one. But look these up, write these down. And that's a supplement that you can start taking to help the arteries because they become restricted. And also you can plunge your hands and feet into cold ice for a couple minutes. It's called the ice therapy session. And just realize that taking your blood pressure and noticing if your blood pressure is like 130/80, that the heart's really working very hard to pump out the blood through the body. And let's see, you can look up horse chestnut, which is very, it's a remedy, natural food remedy. And there's also doing a liver cleanse. The other sign is you can have headaches or be sensitive to light. And we want to check out our potassium deficiency, make sure we're getting enough potassium. That's why it's always good to get a blood panel done. And also cold feet, cold hands, even in a warm room can indicate, low blood pressure. And once again, we look at B12 and certain natural remedies. Also, you may notice your breathlessness when you're going up and down the stairs or just normal daily activity and you're out of breath. It's because then the lungs are trying to force the oxygen because the heart isn't able to flow the way it should, the blood. Muscle cramping is another sign, especially in the legs. And that, of course, is associated with the magnesium. And also, if you notice that your wounds aren't healing, like we notice this in diabetics that are insulin resistant, maybe on your legs or your hands. Just notice the cuts aren't healing as quickly as they should heal. And it should get a scab in like 1 or 2 days. So that's something you need to consult your physician. You never want to let that go. And you don't want to handle that on your own. You want to let your primary care physician know that your wounds aren't healing. Okay, very, very important. Hair loss can be a sign. Nitric oxide always helps with this. It's just the hair follicles, they have blood flow, and if they get constricted, you can notice, oh my gosh, why am I losing hair? Now, the test you can ask your doctor for, he'll recommend, is a blood test, complete blood count, and we can look at the lipids. We can look at the Doppler ultrasound, which is, it measures the blood flow through the veins and arteries, and also a stress test on a treadmill. Now, there's natural remedies. This is where the pomegranate flower is. It's called Narines, Narinas, Naris. And it's actually a pomegranate flower. It's amazing. It decreases the fibers and it breaks them down naturally. And it's extracted from fermented soy, and it dissolves blood clots. Hibiscus tea is really great to decrease your blood pressure. Lymphatic drainage, I like to suggest castor oil to rub on your lymphatic system because it causes the drainage. Start walking if you can. I like small walks, anywhere from 5 to 7 to 10 minutes. A few times a day. It's actually better to walk intermittently 10 to 15 minutes instead of just 2 hours at a time or 1 hour at a time, because it just catapults the body and wakes it up again and gets the blood stimulation. So I like 3 to 5 to 6 small walks a day is good. B1, nutritional yeast, eat sunflower seeds. Niacin is good as a B vitamin. It causes flushing, instant dilation, and you want to keep track of your magnesium and potassium because it all helps regulate your heartbeat off of these electrolytes. Eating avocados, cucumbers, dark leaf vegetables, they all help with the blood. And you always want to make sure, if you're on any medication, to talk to your physician, because you don't want to be eating natural blood thinners and then on a blood thinner. So this is just information for you. And then we can do an exercise. It's called detox breathing. You just lay down and you breathe in for a 4 count and you hold for a 4 count and you let it out. You can do that about 5 minutes. It calms the nervous system, decreases the blood pressure. And before I go, I just want to recommend, you have to have an outlet for emotional stress. Okay, so the cortisol levels remain lower. So you want to find a way, whether it's just sitting in a chair, moving your legs up and down if you can't walk, or going for a walk. I would stay away from alcohol beverages and refined carbs and sugars and junk foods, and definitely vegetable oils. Well, I hope this has been helpful. Oh, I want to remember to say, eat the pasteurized eggs, grass-fed beef, iron, which is sea kelp, which is great, and B12. If you'd like to contact me, I'm at Dr. Kish at straightupsf.com. I want you to have a blessed day, and I'll put my description in the lower box.